To begin, I want to address two issues with critiquing mental health practice. The first is that it's a highly sensitive topic. The awful stigma around mental health issues has people on guard against being put down and marginalized, and rightfully so. Therefore, from the outset, let me say I'm a champion of the fact that every human being has a life process to deal with, and problems are a natural part of it. In fact, we need problems. Without them, our potential would go to sleep. However, we need to be careful not to misinterpret critiques of the system as indications of stigmatizing those suffering. To the contrary, the only way to make progress is to identify and challenge faulty methods. The second has to do with language. Modern linguistics tells us that our words don't just reflect reality, they create it. They do so by describing experiences from a particular viewpoint. Mental health terminology creates the ways in which we view and respond to people's painful states of mind. Therefore, we have to be aware of the implications of the words we use, terms like mental illness, disorder, diagnosis, etc. Remember, these words denote specific viewpoints on people's problems, not the experience of pain and suffering itself. In other words, challenging the idea that bad states of mind are illnesses questions the interpretation and labeling of these problems, not the reality of their existence. I want to tell you about me and the Mad Hatters. For 10 years, I lived in Zurich, Switzerland, where I worked as a psychologist in a psychiatric clinic. I also had a private practice. I worked one-on-one with some of the most extreme cases in the population. I also conducted and continue to do research on mental illness. Do you know the origin of the idea that bad states of mind are illnesses like medical diseases? For example, is it a scientific concept or just a general common way to think about human problems? The answer may surprise you. For millennia, humans attributed deep mystery to physical ailments. The idea that abnormal signs and symptoms could indicate a variety of underlying diseases was a conclusion arrived at only after a century of rigorous scientific research involving thousands of peer-reviewed studies. No one just spontaneously thought to himself, I'll bet chest pain can be a sign of a heart attack, or acid reflux, or a muscle or bone problem, or a lung condition, or a stomach problem. Each of these diseases contains its own highly specific parameters. In contrast, the notion that depression, anxiety, and so on are illnesses didn't arise from scientific research, but rather from a desire to make psychology more like medicine. Instead of scientific evidence leading researchers to the conclusion that bad states of mind are diseases, the idea originated from the common, everyday assumption we make when we see someone who feels messed up or acts weird and think, oh, there's something wrong with him, he's disturbed, or she's sick. Everything about mental health practice, diagnosis, prognosis, treatment, etc., is built on this core assumption. The only problem is there's never been a single scientific study providing evidence for it. To make a medical diagnosis, a doctor uses research data to differentiate the many possible reasons for one's signs and symptoms and arrives at a specific disease entity. In contrast, there's no research demonstrating that mental emotional pain can be differentiated into distinct psychological entities. No studies showing that a specific group of symptoms and underlying processes can be clearly distinguished from all other symptoms and processes and from no symptoms and processes. Without research data to distinguish between underlying causes, we can't identify diseases. Psychiatry and psychology's use of the word illness, as in mental illness, derives directly from the common lay meaning of the word, not the scientific meaning. Nevertheless, groups of symptoms are labeled in a way that makes them sound like diseases, even though there's no underlying research data. Before the 1800s, when germs were discovered to cause sickness, medicine did the same thing. It classified symptoms into clusters and gave them disease names without any idea of what was causing them. The Psychiatry, Psychology, Diagnostic Manual, despite its scientific-sounding jargon, is a dictionary of symptoms with no objective measures associated with them. A diagnosis of clinical depression is like a diagnosis of chest pain, a symptom without any underlying principles or processes. Let me repeat that so it sinks in. A diagnosis of clinical depression is analogous to a diagnosis of chest pain or headache. Chest pain and headache aren't diseases. They're symptoms and could indicate a wide range of underlying problems. But psychiatry and psychology give disease names to symptoms. As soon as the public hears these words, they assume these are diseases on par with medical illnesses. And since there's an organized nomenclature published in an official manual, people think it must be based on science, but it's not.